Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. This video is for informational and educational purposes only. It is not intended as medical advice and should not replace consultation with a qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any questions you may have about your health or medical condition.
Hello, and welcome to Health Matters, an educational series from the Office of Correctional Medicine at Southern Illinois University School of Medicine. My name is Afam, and today we'll discuss chemotherapy patient safety and staff education in a correctional setting. Our goal is to provide you with knowledge and tools to provide care for patients receiving chemotherapy while keeping yourself and others protected. Let's begin with the basics. Under normal conditions, our cells grow, divide, and die in a highly regulated cycle which keeps the body functioning properly. Cancer develops when this process malfunctions. Cells begin to grow uncontrollably and fail to die when they should. This unrestrained cell division can form masses called tumors, disrupt organ function, and cause symptoms such as fatigue, weakness, or increased susceptibility to illness. In correctional settings, the cancers we see most frequently mirror those found in the general population. In essence, cancer disturbs the body's normal balance, which is why treatments like chemotherapy are necessary. Chemotherapy is a treatment that uses powerful drugs to target and destroy fast-growing cancer cells. Its mechanism of action involves disrupting cancer cells from multiplying, resulting in a reduced tumor size and slowing the spread of the disease. While highly effective, chemotherapy can also affect healthy cells in the hair, stomach, and bone marrow, which is why side effects are common. The following chart outlines various methods of delivery in a comprehensive manner. Chemotherapy can be administered in several ways: intravenous lines or IV lines, central lines or ports. Ports make long-term administration easier, but it's still important to handle and monitor each method carefully. Pills or liquids by mouth, subcutaneous or intramuscular injections, or directly into spinal fluid or the abdomen. While each method presents distinct advantages and potential risks, intravenous or IV infusion remains the most frequently utilized technique in the correctional healthcare setting. Chemotherapy patient safety and monitoring are essential. Patients should limit contact with children, pregnant or breastfeeding staff, or anyone with a weakened immune system. Sit to urinate, flush twice, and disinfect surfaces. Wash hands after contact with vomit, urine, or stool. And bag laundry separately and wash on a hot cycle. Patients don't require special housing, but they should remain near medical staff. The patient's body temperature should be monitored twice daily and watch for low blood counts, especially if the neutrophil counts drop below 1,000. We pay special attention to the neutrophil count because these are the white blood cells that play a key role in helping the body fight off infections. As mentioned earlier, chemotherapy can damage healthy cells, including neutrophils, which leaves patients more vulnerable to infection during treatment. It is also critical to listen carefully to the patient's feedback and ensure they are receiving appropriate medications to manage their side effects. Common side effects to monitor include fatigue, pale skin, infections, bruising, nausea, vomiting, diarrhea, mouth sores, hair loss, rashes, nerve pain, confusion or difficulty concentrating. Rarely, patients may experience chest pain, palpitations, or shortness of breath. Report any new worsening symptoms immediately so they can be addressed promptly. Protecting staff is equally important. Bodily fluids can remain hazardous for 48 to 72 hours and sometimes longer. To stay safe, always wear gloves and add a gown and eye protection if there's any risk of splashing. Double glove for spills. Pregnant or breastfeeding staff should avoid handling chemotherapy drugs or contaminated fluids altogether. And wash hands after removing gloves and handle sharps carefully. Never recap needles. Immediate exposure effects of bodily fluids includes skin redness, eye irritation, coughing or nausea. Repeated exposure may cause fertility issues, organ damage, or increased cancer risk. In the event of a bodily fluid spill, use a spill kit immediately. Kits should include gloves, gowns, absorbent pads, disposable bags, and instructions. Clean spills with an EPA-approved disinfectant or bleach solution. Bag contaminated laundry at the source, wash separately, and never shake. If you experience exposure, wash the affected area immediately. seek medical attention, and report the incident. For transport and custody, plan carefully, schedule trips during off-peak hours, follow written procedures, and keep cleanup supplies ready, and document all chemotherapy precautions. Here are key safety reminders. Understand the high-risk period after chemotherapy, listen to the patient's concerns, and watch for side effects on both the patients and the staff. Always wear appropriate PPE when handling bodily fluids, double glove when managing spills, handle sharps safely and dispose of them properly, wash contaminated laundry separately, and report any exposures promptly. These steps protect patients, staff, and the correctional community. Alongside these safety measures, monitor patients closely, maintain open communication, offer annual training for staff, and provide strong administrative support. By following these guidelines, we can provide safe, effective care for patients receiving chemotherapy in correctional settings. Thank you for your time, attention, and for the important work you do each day. We invite you to join us again for more in the Health Matters series at the Office of Correctional Medicine at Southern Illinois University School of Medicine.